Good evening, ladies and gentlemen, and welcome to yet another interesting topic, which is fever and its relationship with intellectual disabilities like autism spectrum disorder, cerebral palsy, Down syndrome, etc. I remember humble self Lucky, doctordrugz, and I have the pleasure of being our host, presenter for today. That's doctordrugz. Our table of content goes thus. We can't talk about this topic without knowing what fever is. The intellectual disabilities will be touched briefly, as we have done that in previous times. Then we delve into the relationship between fever and intellectual disability. Fever and speech impairment shall be just a case study to give us an idea of how important this topic is. And also, emergency measures against fever. Then what do we do when the chips are down? Talk about management in this regard. So, what is fever? Fever is a common medical condition characterized by an elevated body temperature, usually above 37 degrees Celsius or 98.6 degrees Fahrenheit. Now, it's a natural response to infection, inflammation, illness, where the body's thermostat, actually our bodies have a thermostat or temperature regulatory compartment or area or section in the brain called the hypothalamus. And this helps to increase temperature when it has an aim to resolve issues in the body like infection. So the fever we're talking about is actually our body's attempt to save us from one problem or the other. But unfortunately, it comes with other things that we'll talk about shortly. So what are the symptoms to watch out for in a special child with fever? Now, these symptoms will include elevated body temperature, sweating, chills, muscle aches, fatigue, loss of appetite, irritability, confusion in severe cases, and so on and so forth. As you can see, this baby or child over here is seriously battling with fever. And as a special child, he will need special attention. So what are the causes? These include infections, as I aforementioned, inflammation as well. Let us not forget that one of the major problems in an intellectual disability called autism is that there's inflammation in the brain. So you can imagine that fever can also be caused by inflammation. But there's something fun about or something interesting about this. Let us also bear in mind that autism itself too can also cause inflammation. So you can see that there's a very strong link between fever, inflammation, and autism. We'll talk about that shortly. Immunizations don't actually cause autism, but in cases where children react to these things or have some anaphylactic reactions to vaccines, you find their body temperatures may rise. That's why it's very good to give antibiotics. It's actually the fever that may provoke or worsen ASD in such children and not the vaccine. Medications. Now, there are some lectures we've had before, and we mentioned that chemicals are generally not so amazing in children that are living with intellectual disabilities like ASD or autism, and so on and so forth. We talked about that in other videos before. Of course, autoimmune disorders are not left out, and cancer, and so on and so forth. The complications of fever in special children include seizures. We will recall that in our previous lecture, we have mentioned that seizures are not uncommon in children that have autism. Remember that autism causes inflammation, brain, gut, causing leaky gut as well, that allows substances to go through the intestine and go to the brain and can provoke or worsen seizures. We talked about that earlier. We also know that fevers can also lead to dehydration. And what comes to dehydration may include electrolyte imbalance, and other factors that have to do with lack of water in the system. Then behavioral changes can come up. Communication difficulties. We're going to talk a bit about this. I'm going to explain shortly how these communication difficulties can come up as a result of fever. But you see, oftentimes in autism spectrum disorder, it starts after a high fever in many special children, followed by what? Non-verbal attributes. And this, just from little I know, it happens around the age of 1 and 2. You find that a lot of mothers will say the child was actually fine, doing everything okay, and when the child got between the age of 1 and 2, suddenly stopped talking, and it seems as if something just went wrong. You can see that fever can actually be a trigger for this. Of course, it also leads to increased risk of respiratory distress and so on. So we can't do without touching here and there on intellectual disabilities like autism and the rest, just to refresh our memory, but we're going to do this very fast because we have lectures on this on doctordrugz on YouTube, and you can just take your time and watch all these topics at your convenience. Just type doctordrugz, type intellectual disabilities or whatever the intellectual disability of interest you have, and if you're lucky, you find it there and enjoy yourself. So, what is autism? It's just basically a neurological and developmental disorder or a neurodevelopmental disorder that affects communication, social interaction, and behavior. This is just a very simple definition. In fact, it is indeed a silent epidemic, as a lot of families have it and they keep it secret. Now, autism is regarded as a spectrum disorder and this means that it can present itself differently in different people. That means different people have different ways that autism may present. For example, one may just have one of the qualities of autism, of the autism spectrum, and others may even not have any at all. So that means that, technically speaking, to an extent, everybody has autism to a certain degree. And it's just a function of the stressor, ambient conditions. For instance, if someone is very angry, you see the person begins to act abnormally, and you see some autistic tendencies in such a person or autistic characteristics. Or just imagine someone that has taken many bottles of alcohol, and you understand that by the 7th or 8th bottle, if you call the person, he may not even answer you. He begins to have social and other social and behavioral anomalies or social and behavioral issues, communication issue. He may not be able to talk or say his name, and you see that these traits begin to manifest. That is just my own personal opinion, and that's from the little I know and from my little observation. But that a lot of people are actually autistic to just various degrees without even knowing, because it's just a function of what? The ambient accepted norms in society, the stressor and responsiveness to stressor. It's someone that has just maybe lost a loved one, and the person is having perseverativeness and doing something, maybe tapping a shoulder on and on for long. That's why you're doing that. You see, that person is actually precipitating signs of autistic tendencies. But the stressor in this case would be grief and all that. So that means that children or special children with autism should not be cured, unquote, but accommodated with love into the society. That means that they also have a lot to offer that we know. Now, the different types include autistic disorder, known as the classical one. This is very terrible. We have Rett syndrome, we have Asperger's syndrome, we have childhood disintegrative disorder, aka CDD. Then we have PDD-NOS, which is what? Pervasive developmental disorder, not otherwise specified, which is actually a milder form. And these are the signs of autism: difficulty with social interaction, verbal and non-verbal communication issues, perseverative interest. That perseverative interest simply means repetition of particular response, such as word, phrase, or gesture, regardless of the absence or cessation of a stimulus. And you can see stereotypic body movements, stymie, rigid routines, and over or under sensitivity to sensory inputs. That means, let's say, hypo or hypersensitivity. That's basically what I'm saying. And then, of course, restricted interest. They don't want to do anything apart from what they are focused on at the moment. We'll talk about ADHD shortly, the relationship between ADHD and ASD. So what are the risk factors? Older parents. Certain prescribed drugs are not left out. Prenatal issues, perinatal issues, and neonatal issues. These are just issues that happen before pregnancy, during pregnancy, and after birth, respectively. And these complications within these periods can actually provoke autism. Environmental factors are not left out. Chemical substances, I put it in bold because it is one of the major factors that provoke ASD: dyes, drugs, additives, pesticides. Funnily, there are some drugs that are given to calm patients that are having seizures down. But unfortunately, part of the side effects of those drugs that are actually given to calm seizures in special children, children that have ASD down, has a side effect that is autism, or that is seizures and other issues. In fact, it complicates the autism in some patients, because at that point in time, it will help to resolve the seizures. But after some time, the drug that has solved the problem will now begin to manifest its own side effects, which may begin to what provoke autism and may even lead to another bout of seizure again. So it's such a terrible condition, but we have to know about it well enough to manage it better. Then giving birth before the normal gestational period of 9 months, genetics, let's not forget that male gender is a risk factor. That means, guys, be aware that we should not allow this to just be with our wives alone, because most likely the gene is actually transferred from us to these guys, the boys that are mostly affected, and also some girls. Then poor brain development is also another issue. Small birth weight, delayed delivery. Sometimes children have what is called hypoxia, which can affect the brain as a result of complications during pregnancy, as aforementioned. Lack of folic acid, vitamin D, of course, eicosapentaenoic acid and docosahexaenoic acid, EPA and DHA, which are essential fatty acids, are not left out. Let's just bear in mind that it's estimated to occur in 1 out of every 100 people worldwide. So imagine that we have, let's say we have 8 billion people. What this means is that about, let's say, 18 million people are having this problem. And those are the ones that have been diagnosed. So we have others that have not even been diagnosed at all. They're just living and blending in society like that. Now, its onset in early childhood and complications include educational or learning issues, social isolation, all the way down to bullying. Of course, we know that there are 3 levels of autism based on independence and how much support is needed. What's the link between autism and ADHD? ADHD simply means attention deficit hyperactivity disorder. The fact that a lot of children that have ASD are restless. Sometimes if you make the mistake of giving them anything that contains sugar, they are everywhere at the same time. That they begin to display these ADHD symptoms. In fact, it is found that about 30 to 70% of individuals with ASD also have ADHD. And about 20 to 50% of individuals with ADHD also have ASD, so they are closely related. And also, let's bear in mind that both conditions can affect attention span. So this simply is just trying to tell us that they share a common origin. That is what this section is just about. Of course, these are the comorbidities of autism. We talked about seizures already, epilepsy, learning disability, anxiety disorder, all the way to GIT issues, that's gut issues that further lead to substances that are not wanted seeping into the blood through the intestine via a process called leaky gut. That is just what it is. What I call the process of leaky gut, in short. This is how it's managed. The first thing we should understand is that the mother is the first doctor after God. That because her knowledge of this condition and how to manage it is the key to management or reducing the negative impact of this condition. So mothers, we have to also, mothers should try as much as possible to understand this condition, because we know that mothers give the first therapy and all that, speech therapy and all. It's the mother that speaks to the child first. It's the mother that understands the child first, all things being equal. And you can see how important it is. Of course, next we talk about improved neural connectivity, because without improved neural connectivity, even therapies are useless, because that is the only way the brain learns or adapts to its environment. Improve neural connectivity and improve neuroplasticity. We'll talk about that, because improved neural connectivity means that the nerve cells begin to interact or modify their interactions and connections as we learn and adapt each day or every time we do. And then improved neuroplasticity also means that the nerves also modify themselves intrinsically as well to adapt to learning, environment, so on and so forth. So it's very, very key in management. So management, apart from the use of chemical drugs, which of course we know lead to sedation, weight gain, and other side effects, and avoiding risk factors, entails early management via applied behavioral analysis. ABA. We all mothers need to go and understand what this is, even from a basic, just from basic understanding, just have an idea of what it is, and to really help. Remember that these children just come to the hospitals and just spend maybe 1 or 2 hours. The remaining time they're going to spend when they get to the hospital is going to be with the parents and the family, especially the mothers. So you see how important this is. Cognitive behavioral therapy is also very important. And of course, avoid chemical substances in food, cream, soaps, insecticide, and all that. We talked about that in Autism Do's and Don'ts on doctordrugz. Go to YouTube and enjoy that. Of course, occupational therapy, speech and language therapy, which may be useless if there is no improved neural connectivity or neuroplasticity. Then dieting is important. Of course, we know that casein and gluten and all that and sugar have to be restricted. Then use of natural pharmaceuticals to help to mitigate the negative consequences of comorbidities and effects of this health situation by helping with proper neural connections, which is key in brain development. You can see that. Down syndrome, briefly, is a genetic chromosome 21 disorder causing developmental and intellectual delays. And its types include trisomy 21, which is the main one. We have the mosaic one, which is a mixture of normal and abnormal chromosomes. Then translocation Down syndrome, which is just a stump of that extra chromosome. And of course, it doesn't show issues as much as the others. We all know there's a random genetic error in cell division after fertilization, so on and so forth. And the management is simple: physical therapy, speech therapy, occupational therapy, behavioral counseling, special education services, as well as early childhood intervention, and so on and so forth. Let's not leave out natural pharmaceuticals to help against the comorbidities. That's the health issues that coexist with the health situation. These are the signs and symptoms of Down syndrome, from congenital heart defects to hearing loss, poor vision, cataracts, all the way down to late tooth growth, hypothyroidism, and so on and so forth. Here are the causes and risk factors. Advancing maternal age is also a risk factor. Being carriers of genetic translocation is also a risk factor. Then having one child with Down syndrome already is a risk factor. Now, it happens in men as well. Boys, men over 40 at the age of the time of conception also have an increased risk of having a child with Down syndrome, particularly if the mother is also over 35. What this actually means, is that the older the parents, the higher the risk of having a child with Down syndrome, basically. So these are the comorbidities, extra comorbidities, just for better illustration, more simplified. But let's not leave out vision problems, as well as GIT issues, that's gastrointestinal issues, like constipation and all that, are not left out. Tooth issues are also not left. Let's take note of this, because gingivitis and periodontal issues due to low immunity. So you see that it's very important that the immune system has to be boosted, because you can see that there's poor immune function as part of the problems with Down syndrome, and so on and so forth. Cerebral palsy is a neurological and a group of movement disorders that appears in early childhood and is caused by abnormal development or damage to parts of the brain that controls movement, balance, and posture. This often occurs during pregnancy. That's about 80% of the case. Then we have during childbirth or shortly afterwards, up to 3 years. See, cerebral palsy is a neurological condition that affects muscle tone, movement, and coordination. That is basically what it does. And the signs and symptoms include delayed milestones, muscle tone issues, movement difficulties, coordination and balance problems, spasticity, that's stiffness or tightness in muscles leading to jerky or stiff movement, seizures. That happens in about 1/3 of cases of cerebral palsy. Vision or hearing impairment, speech and language difficulties, swallowing or feeding challenges, because it affects muscles, so you need muscles to swallow. Of course, abnormal reflexes, difficulty with fine motor skills, and difficulty with gross motor skills as well, so forth. Let's not leave out pain and discomfort. So these are the risk factors. Preterm birth, being a twin, for certain infections can also be risk factor. meconium aspiration syndrome, when a child gets some of the fecal matter into the airway. Then we have cesarean section, could be a risk factor because of certain factors that have to be certain things that may have to be done that are not the way God designed women to give birth to children. Let me just make that's just a broad summary, because certain errors can take place while trying to do that. And then low blood sugar is another problem. Remember, we talked about damage to the brain. We all know that the brain needs a lot of sugar to function. Then we have some certain substances that should not be exposed to mothers during pregnancy, like methyl mercury exposure. Very difficult delivery, that's low oxygen to the brain during childbirth. Head trauma during the first few years of life. Some children, when they're in school, they climb the swing and they fly and fall and hit their head on something. And the parents don't just understand what's going on. The child begins to have this issue. So that means it can actually happen later in life. So parents, we have to be very careful how we handle our kids. And of course, severe jaundice can also lead to kernicterus, which is staining of the basal ganglia, a part of the brain that is very important. Then we have anything that hinders oxygen or nutrient supply to the brain, like even stroke, can lead to cerebral palsy. So its complications are often due to abnormal muscle tone, reflexes, or motor development and coordination. Now, nerve damage is the key issue in this condition. The secondary issue is often bone and muscle development, as well as its comorbidities. Remember that when a part of the body is not used, it begins to wither off. So you see the children have stiffness and all that. So these are the comorbidities, which include learning disability, speech, pain, all the way down to hip dislocation, arthritis, seizures, and severe cerebrovascular accident, depression, social stigma and anxiety, and so forth. This is how it's managed, basically. Management, apart from use of chemical drugs, therapies, and neurosurgeries, etc., entail use of natural pharmaceuticals. That's as simple as that. Dyslexia is something that is more common than we know. Yeah, there are people that just tell you that they can't go to school. You don't know why, because they've tried and tried and tried, and they know everything, and they can tell you the history of your country. Or give them a pen in their hand, they can't write anything. They can't solve equations. They can't even write a sentence. That's one of the signs of dyslexia. So it's simply a learning disorder that affects reading, language skills, making it difficult to read, spell, write, and comprehend. It's often in association with attention deficit hyperactivity disorder. Remember, this is also a good close ally with autism as well. So on and so forth. Let's not forget that it affects about 5 to 17% of the population. You see what I'm saying? Imagine that you have a country where you have 200 million people, for instance. You can just do 5 to 17% and see that the people that are involved are so many. We're talking about 30 million people or more. You see, that's just like the population of a whole state country. So the problems include difficulty writing words, reading out words from the head, reading quickly, spelling words, pronouncing words when reading aloud, understanding what another person has read. Then, of course, having issues with rhyming words, remembering dates, names, learning names and sounds of letters, etc. This is so terrible. So people with this disorder often have a normal desire to learn. There's a passion to learn is there, but it's more like the spirit is winning, but there's no capacity. You see. So, causative risk factors include the family history of dyslexia, low birth weight, premature birth, exposure to substances during gestation that affects brain development. That's why it's very important that when women are pregnant, we normally pamper them and make sure that they are not exposed to dangerous substances. So these are the complications: struggling in school, low self-esteem, mental health issues, behavior problems. Person becomes radical because, there's nothing, he that lay on the floor, fear no fall, that kind of stuff. And then lack of motivation is also another. This is how it's managed. Of course, early identification and diagnosis. But all these things go down all the way to use of natural pharmaceuticals to improve neuroconnectivity, plasticity. So what's the relationship between fever and intellectual disabilities? You see, Communication difficulties can emanate. Fever can impair communication skills, making it hard for special children, especially those with ASD, to express their needs or discomfort, as it affects where the Broca's area in the brain. Possibly, that area is very key regards to speech and a lot of other things. We will talk about that shortly. Increased anxiety and stress, and see fever can lead to that, especially in special children, especially children with ASD, may already experience anxiety. Then you add fever, that is worsens the situation. Sensory overload is not left out. Behavioral changes are not left out. Even children that don't even have, children that are not even having intellectual disabilities have behavioral changes when they have high fever. Some of them begin to hallucinate and begin to say things and all that. So imagine a child that is having intellectual disabilities, what fever can do. Seizure risk is very, very crucial. In fact, I have a child that died recently because the child had malaria, and then I don't know who gave the mother a kind of anti-malaria that takes time to build up in the system, rather than give something that would have had rapid onset. And the child was having seizures constantly, I think for how many days or hours, for so long. In fact, it was so sad when I heard the news, but there was nothing that could have been done. The fever had already taken its toll on the child, and it was just a matter of time before the mother went to school. Before she came back, the husband was already saying that the child was gone, as fever was what helped to seal up the fate of that child. Malaria fever, particularly, led to seizures, steady seizures until that child died. So you see how terrible. Of course, it got disrupted youth routines, because when fever forces changes in daily routines, like you can't sit down in one place, you see that children that have perseverativeness find it difficult to adapt, because that they are used to routines that they are already rigid about. And fever now restricts them, and this can lead to issues. Social withdrawal is not left out. Then medication sensitivities are not left out, because fever can actually provoke those chemical reactions that make chemicals contraindicated generally in special children, like those are in cases like in autism, for instance. You find out that it's not this matter is not left out in cases like that, because you see, autism already has predisposed the child to being hypersensitive to certain chemical factors, and you can now see that when fever comes in, it now worsens this sensitivity. And then medication or things that the child has been taking before to help, the child may begin to react to them as a result of fever and its comorbidities. And of course, this has to be taken into cognizance. Now, monitoring challenges can be part of it, because special children, especially those with ASD, have difficulty communicating their symptoms or discomfort level, making it even harder for caregivers to monitor their condition. That's another very big issue, because the fever is already there, but the child cannot even say what's going on. That's another problem. Then increased risk of dehydration. Remember that fever increases temperature, and what happens to fluids when temperature goes up? They begin to evaporate faster, and that's how fluid begins to leave the system more, and the child will become dehydrated. Let's not even forget that the child may not have appetite to even take water to replace what has been lost already. That's a big problem. Now, of course, it affects sleep patterns, as we know, all that worsening ASD. So let's just take this as a case study. That's how can fever affect speech in children? You see, above shows the part of the brain that controls speech called the Broca's area. You see, the Broca's area is located in the left hemisphere in most right-handed people. It's associated with speech production and articulation, ability to articulate ideas, as well as use words accurately in spoken and written language. You see, just imagine the functions of this area. So you can imagine if fever affects this area, what do you think will happen? The child begins to exhibit autism spectrum disorder. That is just what it means. But this is not the only part of the brain that can be affected by fever. But I'm just giving this as an example, because one of the major signs of ASD is speech difficulty that's being non-verbal. You understand? And you can see that fever can lead to this. So if anything happens to this area, a special child is then non-verbal. Just so that you know that this child is having autism. But guess what? Without improved neural connectivity and neuroplasticity in the Broca's area, speech therapy may be completely useless. If that area is not improving, there's nothing you can do. No matter how much you spend on therapy, that child will not be able to talk. So, and let's also bear in mind that nerves grow or recover relatively slowly, and this means that in order to assist this part of the brain to recover or grow or improve its nerve or neural connectivity, one must really be patient. But let's not forget that the earlier, the better, because the younger a child, the easier or faster the child recovers from issues. So even though the nerves heal slowly, remember that the brain is still growing actively, so you can actually direct the brain to grow in the proper direction. So we talked about fever and all that. So how do we tackle fever when it happens? What are the emergency measures against fever? Of course, we have to seek, or one has to seek immediate medical attention if the temperature exceeds 39.4 degrees Celsius. Let's not even allow it to get there in the first place. Now, when the fever lasts more than 3 to 4 days, please don't allow it to get there. When seizures occur, please don't allow it to get there. When there's difficulty breathing, severe headaches or stiff neck, confusion or disorientation, remember we also have to, of course, administer antipyretics as directed. Of course, you see that. We have to also encourage fluid intake and, of course, use cold compress or lukewarm bath to reduce temperature. So you can see that we need to seek immediate medical attention if the temperature exceeds 39.4 degrees Celsius or 103 degrees Fahrenheit, when the fever lasts more than 3 to 4 days, when seizures occur, difficulty breathing, severe headache or stiff neck, confusion or disorientation is already coming in. Of course, you can see that one has to seek medical attention immediately. Don't even waste time. Additional considerations for special children include we have to monitor temperature regularly. Use visual aids or communication tools to help individuals express the comfort. Like if the child is able to give some signal, you can actually use that to help to know what's going on. Then provide a calm, comforting environment. Imagine a child having high fever and you put the child where there's so much noise, where people are watching football and everybody's shouting, worsening the situation. Then consider consulting a healthcare provider for personalized guidance urgently so that you don't make mistakes. I just want to talk about management when the fever has already caused problem. But this is just a brief conversation we're going to have now, because we have talked about this when we talked about improved neural connectivity, diet do's and don'ts, and so on and so forth on doctordrugz. See, the human brain is actually malleable, adaptable, changeable, etc. And this is how the brain learns and stores information. But the rate of this changeability is inversely proportional to age, meaning that the older one gets, the slower the brain adapts or changes. Now, hence, generally, the earlier the required changes are made, better. I hear some people saying that when they went to the hospital, they say, just leave the child, let's see whether it will happen, it will improve, it will get better. And the child is down 3 years, 4 years, 5 years, there's no improvement, and the health practitioner is still telling the patient, maybe we should just see whether we should just wait a little. Brother and sister, Lord, that could be disaster. Brewing, that's how to brew disaster. Because before you know it, the brain becomes more rigid and the management of these intellectual disabilities become more difficult. Take action fast and early. That's the best. And there's a higher chance of resolving a lot of issues that are associated with these intellectual disabilities. So in relation to intellectual disabilities like autism, this simply means that the brain is easier to reform when the child is younger. In other words, the earlier, the better. You see how the brain changes or how the brain adapts is via improved neural connectivity and neuroplasticity. That is it. The brain changes or learns or adapts via the aforementioned, which is improved neural connectivity, and the ways this can be achieved include what experience. You can see we talked about applied behavior analysis. But remember that nourishment is not left out. So as the brain is getting what it needs to improve itself, especially when you use natural pharmaceuticals, you find out that experience also marries itself to these improvements and the child begins to get better, faster. That's how we achieve results. That's how I've been able to have a lot of amazing results with my patients and so on and so forth. So just a brief or just a little flash, let's just throw a little light on applied behavioral analysis. We talked about it a couple of times before. Now, ABA, or applied behavioral analysis, is a scientific approach to understanding and changing behavior. It involves the use of techniques based on the principles of behavior analysis to increase desired behavior and suppress or reduce problem behaviors. You see, ABA is often used in the treatment of autism spectrum disorder, as well as other developmental disabilities and mental health conditions. So it's very amazing. And let's take a very close look at this. There are some key components of ABA, what I'll just simply call as the 10 commandments of ABA in short, because there are about 10 in number. Of course, functional analysis, goal setting, assessment, intervention, evaluation, positive reinforcement, prompting, chaining, shaping, extinction. These are what we should try to know, especially when we're trying to help these children to improve. As, of course, neural connectivity is improving, we also have to make sure that what the child is imbibing is in line or is going to be helpful to the child intellectually. You can see a father practicing ABA with a baby or his son. Well, let's just talk briefly about the importance of natural pharmaceuticals in management of intellectual disabilities. I often talk about this because it's the best approach. That's when we're talking about having no side effects. Because one, they're from natural sources, the body accepts them, and two, they help these children to get better in various ways we're going to talk about shortly. Of course, you see that there's brain food that helps the brain, in that all these intellectual problems are referring to problems emanating from the brain. And you can see that it helps to boost immunity. Let's not forget that trisomy 21, Down syndrome, brings down immunity. Of course, manage cardiovascular issues, improve thyroid function, prevent and manage dental issues. These three just mentioned now, or four, have to do with a lot to do with Down syndrome, which also leads to intellectual disabilities. They have to provide natural neurotransmitters for improved brain function and mood. Let's not forget that one of the most important neurotransmitters in the brain is acetylcholine. You can see that in royal jelly, you find that, and of course, you find it in as acetylcholine in something called Focus. It's in something Focus, and then we also have that royal jelly containing choline in its natural form, which is converted to acetylcholine in the brain, helping to boost the brain function. Of course, they help to improve neuromuscular function. We have things like L-arginine, which is a protein that helps to improve muscle mass. And let's not forget that this improvement of neuromuscular function is very essential in cerebral palsy. They help to mitigate gastrointestinal issues. Leaky gut is a very serious problem in children that have intellectual disabilities like ASD. You see, because when the gut gets inflamed, substances that should not be allowed to go into the blood from them goes in and can lead to brain issues. Because guess what? They go straight to the brain and begin to trigger inflammatory or unwanted reactions or activities in the brain. Then, of course, they help to relax the brain against insomnia. Choline can do that sublingually. Then they help to improve or maintain bone integrity. Then, of course, improve nerve function of the brain and body. And, of course, general regeneration and rejuvenation of the body. That's just part of it, so on and so forth. So let's just look at, I personally use this company because from experience, I really don't like stories. I'm not saying that we should use these particular products, but these are the products I've used for my patients and I've had amazing results. And this is just because of what they contain. So I'm not going to talk too much about them because we talked about these things in the past a lot. But you can see that there's something called the immune blend here. That is over here. Contains matic and shitic, which helps to boost immunity. Cardio health, which is this, contains coenzyme Q10, which helps with regeneration and rejuvenation of heart, lungs, liver, and kidney tissues, which is very amazing. Apart from the fact that it also has very, very good qualities that are very essential for these children, like improving learning ability. That is something that we should not forget. These products I gave to a child that was finding it difficult to learn, and in a space of 3 months or so, this boy had become a lawyer, judge. In fact, the journalist was just talking, and the parents were of course, the mother was so happy that she took that decision. Let's not leave out Arctic Sea because it contains eicosapentaenoic acid and docosahexaenoic acid, which are in the best form possible. We're not talking about EPA and DHA made via heat processing. This is cold chain. So the integrity of these molecules, which are fragile, these essential fatty acids are fragile, are left intact. That's why you see that once children begin to take this, the result is outstanding. I gave this to a child at Navy Town, yes, and the mother was so happy showing me the result of the child improvement and all that. When the child came back from school the other day, that was something nice. Ultralight helps to mitigate the negative effect of casein, which is found in milk. It's an alternative for casein. You can see it here because it doesn't contain casein, and children can use it and escape the negative impact of casein in special children like those that have autism. The tooth gel you see here does not contain fluoride, and of course does not contain triclosan, which are contraindicated in certain intellectual disabilities. This is royal jelly we just spoke about. It contains choline, which will help with acetylcholine in the brain. This is B12 plus, which contains, where is it? That's it over there. Contains cobalamin and folate analogs. Of course, we know the effect of these cobalamin and folate analogs with regards to improvement of nerve function, and of course, regeneration and rejuvenation of nerves. Let's not leave out pyridoxine, which is B6. And you see that the brain, as in a layman's terminology, is just a ball of nerves floating in fat. So you can see that when you give the brain something like this, what do you think will happen? You see the brain begins to function better as the nerves begin to develop faster and better as they ought to. Probiotics is not left out because it's good bacteria with regards to the gut. Remember what we talked about when we said, remember what we said when we talked about leaky gut, inflammation in the gut. Fiber helps with bowel movement and more. This blossom tea contains chamomile that helps against the ADHD that is strongly linked with dyslexia and autism. The calcium or dicalcium malate is a unique type of calcium that stays longer in the blood. So the wasting away of the bones associated with cerebral palsy is mitigated. Let's not even forget that propolis cream will help to heal up wounds and sores that appear when children have cerebral palsy. Maybe they fall and injure themselves. Rather than put iodine and all these things that send free radicals directly into the blood, you know that free radicals actually don't help children who have intellectual disabilities like ASD. So you see that this contains propolis, which is a natural, powerful antimicrobial agent. Not only does it have antibacterial qualities, it also has antiviral and antifungal activities. It's amazing with regards to this. It's always somewhere around me. I cannot find it now. I wish I could show us an example of what it is from the table here. Do I have it here? Yes, it's always around because I use this when I have, that's it over there. See, when these kids come around and just rather than use substances that can provoke them, you see that I just use this instead. Now we have collagen, of course, an elastic lotion, because we don't want these kids being exposed to certain kinds of lotions that contain materials that worsen intellectual disability. Aloe spray is not too far from what we mentioned when we talked about the propolis cream. The Bits and Peaches contains carotenoids that are good for the eyes. And remember that the eyes are more like extensions of the brain, so also good for the brain as well. Nature Mint contains a lot of natural vitamins and minerals. That's why they just short into Nature Mint. And of course, AG Plus is amazing for children that have, that's it over there. Sorry, it came late, but it has to be late than not to come at all. You see, AG Plus contains L-arginine, which is amazing because it's part of the building blocks of proteins. And guess where we have a lot of proteins? In the muscles. So you see that children that have cerebral palsy will benefit from this a lot. It's just a summary. And with that, I'm going to leave us with this. Let us bear in mind that you are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we have to be on the winning side. This simply means that special children should definitely avoid what they're not supposed to take and also take what they are not supposed to avoid in order to keep them on the winning side. That note, I'll say thank you very much. And remember to consult with a healthcare professional or registered dietitian to determine the best dietary approach for specific needs. Additionally, consider consulting with a health professional before making significant changes to diet and all that, and every other thing that has to do with these special children. So thank you so much for coming, and remain blessed. Bye.